Do you know what is the leading cause of death among Asian teens and young adults? Suicide. I am a mother, pediatrician, researcher, and community organizer. I am here with my fellow clinical scholars, Team Kapwa, to share with you how we are tackling this wicked problem in our community. We have focused on Filipinos, the second largest Asian subpopulation in the United States. As a Filipino American, I have learned that he who does not know how to look back at where he came from will never get to his destination. I am the child of immigrants from the Philippines. My parents are from Agoo, La Union and Bacoor, Cavite. My grandfather fought in World War II alongside the US in the Philippines. He married my grandmother during wartime. They were raised in a generation where they were not encouraged to show their emotions. Children were expected to keep quiet and obey because survival was their priority. They were able to lift themselves out of poverty and immigrate to the US for a better life. I was born in an area of Los Angeles called historic Filipino Town. Growing up, I was fortunate to live with my grandparents. My grandmother, affectionately called Lola in Tagalog, left the Philippines to help raise my sisters and I. I was very, very close to her. Lola shared her love through our stomachs. She always asked us, "Have you eaten yet?" She also taught us the importance of respecting your elders and the importance of family. When I moved away for my pediatrics training, she lived with me for months at a time. And when I became a mother, she again helped me raise my daughters. My heart belonged to Lola. I couldn't imagine life without her. At the age of 92 years old, my grandmother passed away after battling cancer. I still remember that early winter morning. I wanted to tell her, "Lola, I love you so much. Thank you for everything you've done. And I'm sorry if I always wasn't there for you." But those words didn't come out. My last question to her before she passed away was, "Lola, are you proud of me?" And she said yes. And then I asked her why. And she said, "Because you love me." Those words meant the world to me because it wasn't because of my accomplishments or because I was a doctor. Growing up, our family rarely said, "I love you." And I didn't have the highest self-esteem. But looking back, I understand now that my parents showed their unspoken love through their sacrifices, immigrating here so that my sisters and I could have the best education. Yet, as a teenager, it was confusing. Watching on television, families openly express their love for each other and openly talking about their feelings. In our community, I was also seeing families affected by drugs, teen pregnancy, cutting, depression, and suicide. So I decided to become a pediatrician and researcher to give back to the community that raised me. First, I had to look at the data. According to the Centers for Disease Control, 46% of Filipina teenagers had seriously thought about committing suicide. Half of those teenagers actually attempted suicide. When we look at Filipino middle school students, in a Northern California school district, I recently learned that 1 out of 3 students had seriously thought about committing suicide. When I hear these numbers, I see faces in our community. For instance, this is a young Filipina mother with her newborn infant. She had taken her own life and the life of her newborn. Her mother, who is a nurse, gave us permission to share her picture here in order to increase awareness about suicide prevention in the Filipino community. Each of these lives matter. Over the past 18 years, I've been working with community members and listening to their stories to figure out why suicide is not recognized as an issue in our community, and how do we come up with solutions together. I realized we needed to reach out to other health professionals.
I am one of the healthcare professionals that Dr. Joyce Javier approached. My experience has been that Filipinos are an invisible minority. This is despite the fact that Filipinos are all over the world. For Filipinos, working overseas is a means by which they build and help their own families. There are over 2 million Filipino overseas workers, and they are here from Saudi Arabia, Europe, Japan, Australia, and here from San Francisco, Chicago, Hawaii, Los Angeles, and New York. There are about 4 million Filipinos living here in the United States. So when a fellow pediatrician asked me to assist in suicide prevention in our community, I was curious because I was seeing it come up with my patients numerous times in my over 30 years of practice. So how do we approach in addressing and preventing this problem?
By understanding the strengths and the roots of our community and asking the community, why is this important? What are the solutions and how can we improve the lives of this multi-generational community together? As a young child, I witnessed family members suffer from mental illness, so I can empathize. When I was 12, a friend of mine attempted suicide, and I didn't know how to talk to my mom or dad about what I was feeling and what was going on because I feared their reaction. In time, I realized that I was not alone in this feeling and that this was intergenerational. So we needed to take a deeper dive into understanding the culture of mental health in the Filipino community. And so we did. As someone who was born in the island of Cebu and immigrated to the United States and lived and grew up in Los Angeles for over 30 years, I knew that this was important. So what we've learned is that our community has intersections and has intersections with various sectors and has historical institutions that have influenced the community today. What we've learned is that in 1587, we arrived on Spanish ships and landed on what is now Morro Bay, California. Not long after that, we would jump similar Spanish ships and escape and live in what is now known as Seattle, New Orleans, and even Cuba. What we know is that over 1,300 men, women, and children were put on public display at the St. Louis World's Fair in 1904. What we know is that our Filipino community has faced discrimination. In a time of anti-Filipino sentiments, in California, in parts of Northern California, signs like this were posted. Similar signs, even at public swimming pools, read, "No dogs or Filipinos allowed." And in the 1900s through the 1980s, a systematic overhaul of Filipinos that impacted the nursing profession. So if you've ever wondered why there's so many Filipino nurses out there is an intention behind that. There is a complex, systematic explanation that was articulated very well by Professor Catherine Sinisa Choi as an empire of care. In short, through centuries of colonialism and imperialism, has dug deep into our community. Even what I'm wearing today, this material culture, this barong Tagalog, has its roots in colonial oppression. So this is why it is critical to understand this, because it is our community's identity. It is who we are. It is who I am. Although we're all over the world, one thing connects us all. It is a core value and essential Filipino construct called Kapwa. And by Kapwa, we mean shared identity. And by Kapwa, we mean what happens to you happens to me. What happens to him, her, and them happens to us.
Understanding the culture calls for understanding the language. I am an occupational therapist, an immigrant from an island called Cebu in the Philippines. The Philippine language is not only limited to the 170 dialects that spread throughout the Philippine Islands. Its diversity expands to how the language of love is expressed. The language of doing acts of love, such as living life in the Philippines in the hopes of brighter futures in the United States. The act of working 2-3 jobs to provide for the family back home and in America. The act of showing strength to model resilience in the face of adversity. Our shared understanding that love is an action word rather than an emotion. Our shared understanding that when families do things, it's because they love you, even though they may not say it. One thing we didn't understand is how our community defined mental health. So we ask, what words come to mind when you hear the word mental health? And this was their response. But the word family in the middle caught my attention, as this validates my personal feelings. As a young child, I struggled with my emotions. Getting up in the morning to go to school was very difficult for me. Oftentimes, I would pretend I was sick so I didn't have to go to school. But I didn't tell my family about it because talking about feelings is not what we did. But I couldn't help but wonder if I was born and raised in a culture that it's okay to talk about feelings, would my experiences be different? We also asked families to define childhood mental health. And this is what they said. This affirms that the community believes what Team Kapwa believes, that mental health promotes well-being, and well-being is achieved when family relationships are nurtured.
And so we asked the Filipino community of Los Angeles, what can we do about the problem of suicide among the teens in our community? And the community gave us an answer. They suggested that we focus on the family first and then provide positive parenting training during the school age years before these children become adolescents. And that's what we did. And we found that positive parent training was not only effective, but it was very culturally accepted by the community. Research has shown that there are two important protective factors against the risk of suicide that reduce the risk of suicide. One is family connectedness, and the other is other adult caring. And so this is our challenge for you today, is to build that relationship with your child through spending special time with them, doing an enjoyable activity. The challenge is to build that family relationship, and we build it through the gift of time, by spending time with our children, doing that enjoyable activity together. By giving the gift of time, you make your child visible, a child who's often unseen by the rest of the world. Your time and attention make your child feel important, make your child feel valued. And by showing your love, not just by working multiple jobs and giving your child a great education, but giving them the gift of language as well as your time. You show that you value them as a person. So let them know how proud you are of them. Let them know that you love them. Through the gift of time and language, it's like giving your child a vaccination against the hardships of life that will come later on. By giving them your time and language, you're going to make them strong and resilient people.
We are so grateful for the many families who've participated in our studies and our programs. Without them and their courage, we wouldn't be here today to share our collective message. There's no such thing as a perfect parent. And our children don't expect us to be perfect. They just want to know that we believe in them. I've also learned that parenting is not a skill that we're born with. It's a set of skills that we can learn. And we can embrace these skills and adapt while at the same time honoring the culture, the values that our parents and grandparents have passed on to us. Reflecting on my own journey as a parent, I can't help but think about my grandmother. She gave me the gift of time. She made me feel like I mattered, that I belonged, and that I wasn't invisible. And yet, on the day she passed away, I wasn't sure if she was proud of me. As a mother, I want my daughters to never doubt that I'm proud of them. In addition to giving them the gift of time, I'm trying to give them the gift of language, saying I love you, saying I'm sorry, and encouraging them to share their feelings with me. As a parent, we can't control everything that happens to our children, but we can control our relationship with them. We are Team Kapwa. Each of us encourages you to give the gifts of time and language to your children. As Mother Teresa once said, if you want to change the world, go home and love your family. Maraming salamat and
Mabuhay!